Oh, thank you guys so much. And thank you for spending some time with me today. I want to thank Assisi Animal Health for sponsoring this. It's an ambitious topic today because we're going to try to roll into the concept of how you can add new stuff, whether it's products or services to your clinic. So there's that element. And then on the other side of this, we're going to talk about, pulsed electromagnetic therapy for dogs and cats. So it's really exciting. I'm going to try to blend them together, integrate them together. And again, I want to thank Assisi Animal Health because what they're really trying to do is help us as general practitioners and specialists to learn how to make it work, right? It's one thing to have amazing research and resources and tools, but if you can't implement them effectively, then, our pets don't benefit. So again, I'm Dr. Ernie Ward. We will kind of switch over to some slides, the art of change. If you're into the social media thing, definitely go ahead right now, head over to Instagram and just like or whatever, follow Dr. Ernie Ward. I post a lot of good stuff. Many of you know we have a weekly podcast. This week, it's all about, what to do and when your staff calls in sick at the last second. So if you're not tuned in to the podcast and you like podcasts, definitely check us out on any of your favorite platforms. And of course, you can always reach me at drernieward.com. So let's jump into it. When it comes to buying new stuff, and we're coming up on that season. It's all weird, right? Because normally we would have gone to VMX or North American and, started to see all the stuff at Western and say, oh, I've got to have the new thing. But that feeling when you add a new drug, a new therapy, a new piece of equipment, anything in your life, we call it buyer's bliss. You're probably familiar with that term. It's this euphoric feeling that you say, wow, I've got the latest stuff that's going to revolutionize my practice. And we've all been there. But sadly, many of us also are familiar with buyer's remorse. When we get that new gizmo and now it's become a glorified coat hanger over there in the corner somewhere that we just parked $35,000 in collecting dust. And now we realize, wow, it's not revolutionizing our practice. It's not changing it. And so today I want to walk you through some of the steps that certainly I've used and in my consulting and certainly my personal practice and life to overcome that and to make better, more cogent decisions that actually benefit either me personally, my family, my practice, my patients. So I really want to walk into that. So the first part of this, and we're going to be blending it all up, it's a mishmash. And if you have questions, I think you can add them in that Q&A section, and we'll be getting to them towards the end of this session today. And I think there may be a race questionnaire. So I guess if you're note-minded, you may want to take some notes here and there. You'd probably be obvious whenever you see some nice peer review stuff. But we're going to start by talking about adding new stuff. And I think that this is something we don't talk enough about because we really need to have a strategy, a methodology to adding new things. I really credit... I mean, obviously, my father had a huge influence on the man that I became, but my father was an old school entrepreneur, and he kind of bounced around from business to business. And so, some years we had really nice Christmases and nice gifts at birthdays, and others were hard candy Christmases. So I learned a lot of lessons from my dad, but what I think I took away most was he had a strategy, he had a methodology, and strategy and methodology don't guarantee success or positive outcomes, but they do allow you a pathway to have a better shot at succeeding. And my father was actually, was successful. I mean, I'm not trying to minimize that, but my point being that I think that we don't learn that lesson in life enough. It's like when we see new shiny objects and we go, want, must have, need, or a really convincing salesperson says, you need, this will benefit. And we don't then sit back and say, there's a system that I then apply this new thing and I see if it works within my practice, if it's going to benefit me or not. And I use the term acquisition agony. And really, I started giving this talk about 15 years ago, and color flow Doppler ultrasounds were kind of this thing. And I was seeing all of my friends and colleagues go out and purchase $30,000, $40,000, $50,000 ultrasound machines, general practitioners, right? People just like me. And none of us knew how to use these machines. We hadn't been taught how to interpret it. Man, when we were in vet school, it's like, we got an ultrasound, so we didn't have that experience, that depth to rely on. And so I started really saying, Is it the right thing for your clinic? And that's really where this type of, I mean, I've written about this for years, this methodology. And so the first thing you've got to ask yourself, whether it's adding Calmer Canine, a CC loop, whether it's adding that ultrasound, whether it's adding whatever, is does your clinic need it? And there are many ways to arrive at that answer. And I'm just going to kind of talk today in terms of the Calmer Canine, a CZ loop, the stuff that we're talking about today. But remember, this can be applied broadly to any decision that you're trying to make. And when it comes to does your clinic need it, the numbers say yes for a CC and Calmer Canine, because this is a big number. It's estimated, the latest prevalence estimates are about 1 in 7 US dogs suffers from at least one sign of separation anxiety. That's about 13 million dogs. We don't have good treatments, right? I mean, behavior modification is really the only thing we can give lasting. We have to use multimodal approaches. And so often for most vets, we just don't have the time, expertise, or maybe even interest in dealing with all these behavior cases. So we just sort of ignore them, punt them, we don't provide the optimal treatment. And so today we're going to say there are some other ways to treat this for sure. Medications, like most of us, as veterinarian to veterinarian, we do rely on drugs. So for me, if I'm looking at a patient that's suffering from severe CSA, anxiolytics are going to be a mainstay of that treatment, certainly within the confines of my veterinary practice. Lots of pets out there are not coming to the vet for these issues, and they have mixed results for sure. I think we're here today because of these two factors. These devastate homes. They fracture the bond. They end up in relinquishment and even euthanasia. And if you've been a veterinarian for any length of time, chances are you have had a client come in and say, hey, I'm at my wit's end. Buster is just constantly barking, destroying the furniture, peeing on the rugs, whatever it might be, right? And they've now decided that it's time to euthanize. And we can do better. I think we have to do better. So again, how do we know if we need to add this? Well, I'm telling you, the numbers support that certainly when it comes to canine separation anxiety, we can do better. There is demand. So what do we want to do is, in broader sense, is what's the identity of your clinic? And so when I'm adding that new product, so let's say, again, we're separation anxiety. There's a big demand out there, and I think the evidence supports that for sure. But is it consistent to treat this with like a Calmer Canine? Is that consistent with the identity of my practice? And this is important because, we have to understand that our community identifies us in a very simple rubric, quite frankly, right? There is the cheap vet. There is the emergency vet. There's the really expensive vet, right? There's the really nice vet. And you are somewhere in that category, right? And people often think, well, I'm the cheap, really good, nice vet. Maybe, but chances are you're the cheap vet or you're the really good vet. You're probably not identified like that in the public. And so the reason I bring this up is because if your delivery of medicine, if your public identity, if you can stick with me on that terminology for a second, is such that you are the cheap vet, well, people may not be coming to you for more advanced treatments, more complex cases. Now you say, well, that's ridiculous. Of course they come to me. They've been to 3 other vets and I'm the one who'll treat the cancer for $50, whatever. That is true. But now when you start to introduce, think products such as like a Calmer Canine that they may have to dole out a couple $100 or more, is that going to be consistent with your clientele? And so this clinic identity is really an important concept. And, if you kind of go back and dial back the tape to some of my early, articles 20, 25 years ago, I was always trying to advocate for this, to say, know who you are. What is it you're trying to do? Who are you? I mean, I've spent a lot of time just exploring that, not only in my personal life, but trying to get vets to ask that question. But this is really the foundation. Now, I will say this. I will argue that the vast majority, we're talking 95% of clinics out here, can integrate, can use, and actually be successful with things like Calmer Canine. You can succeed with things like class 4 laser therapy. I mean, there's a nice list of things that even if you're known as the cheap vet, you can integrate, but you've got to make sure that you understand who you are. Now, you now have to match up your community or public identity with what's your mission, right? I mean, what are you trying to do here? And I know it's easy. Like, there's a check down response, a knee jerk response. Well, I'm trying to help save lives. I'm trying to improve the quality of life for my pet patients, right? That's great. And sometimes that's aspirational, but is it real? Is it authentic and genuine? I mean, we really have to sit back and say, what am I trying to do here? And I know that's way outside of the scope of this, so forgive me, both the audience and CC, but we really do need to get into that introspective space and say, what am I trying to do? And then more importantly, what am I good at? Right? So if I look back at my own personal journey, I realize, okay, there's several things that I'm passionate about. And one of them, if you think about it, it was longevity and behavior. And I thought those were both intimately intertwined, but longevity led me to obesity. And that's why my voice is a little raspy. I've been lecturing all morning on obesity for the European Congress. And so, my point is that you find what you're good at, what you love and you're passionate about, and then this fuels the mission, right? But too often people don't really give it, again, that thought, that methodology, that process. And then, of course, we sync that up with what client needs and desires. And we're going to share with you some more information as we move through this presentation today. But clients want this. They need this. This is something that is saving lives. So again, when it comes to separation anxiety and chronic pain, wow, the case is pretty clear. Am I good at it? Am I passionate about it? Do I like dealing with older pets? Do I like dealing with clients who really need to unload about the behavior problems, right? Because there are a lot of vets who are saying, I just don't have time for that. That's fine. But anytime I hear a vet say, I don't have time for that, all that tells me is that's not where your passion is, because we all know that when you're following your passion, time sort of becomes it's not a factor anymore. It's like, I love doing this, right? So I think hopefully that made some sense to you guys. We've also seen a shift when we talk about, does your clinic need it? Do you need this? We know that there's been several shifts that have occurred in the veterinary marketplace, and that, I'm going to call it today pandemic pressures, because really these just accelerated trends that were set in motion, 5, 10 or more years ago. And clearly the shift towards in-home and telehealth services. I mean, you guys, we can't open our emails every day without some new telehealth, telemedicine, teletriage service dumping us a sales pitch in our inbox. And, I get it. And look, I'll tell you exactly what's going to happen right now. We're in a bubble. There's rapid expansion in telehealth. You're going to see consolidation and contraction this side of next year for sure. And it's going to be rolled up into a few major players, a few, maybe 5, 7 or so, like most consolidations occur. But so we're seeing this in home. People want things to come to them, right? That was set in play many years ago. I mean, that's Amazon playbook, right? But now, of course, it's come to the vet world. But I also think that we have this opportunity to amplify our in-person services. And we're going to talk a little bit about that towards the end of today's presentation, but, extend and amplify. To kind of let that rattle around your brain the rest of the day. When you go through the rest of your day, ask yourself, how could I extend what I'm doing right now? How could I amplify what I'm doing right now? And when you start to challenge yourself, you realize, oh, wow, there are lots of pet patients that I could be seeing that I can't for a variety of reasons, many of them logistical. Okay, so whatever. And then also, I like uniqueness. People, let's face it, pet owners have more choices than ever before. I mean, this is indisputable. But what I'm looking for are things that kind of are different, right? And that's why when we look at targeted, pulse electromagnetic therapy, I'm like, hey, that's really interesting. We'll show some of the scientific evidence to support its usage. But, I'm looking for that unique in. I want to distinguish and differentiate my services, my practice, my mission, my belief, things that align with my core competencies and what my clients want, right? So all of that stuff that we just had in the previous slides, that just got distilled right there. And so when I can get that uniqueness and sync it up with, wow, I'm good at this, I love this, and my clients want this, holy cannoli, we got it, right? Now, after you determine if you need that service, whether it's a calmer canine or whatever, you then have to believe in it. And, you know, I know that I've written these articles and given these lectures, and people are like, well, what do you mean believe in it, right? Why do you use that word? Well, I use that word deliberately because belief sort of is this different level than just saying, you know, 1 + 1 is 2. The belief is, I believe that mathematics gives me absolute answers, right? The quantities that we've identified as the numeral 1 or the amount 1 signifies that when you add another 1 to it, that it always will give you that 2. And so that's a different thing than saying, I believe in the concept, the precept, the construct, the foundation of mathematics giving me truths, right? That's the belief that we do. And you know, certainly, you know, science is littered with exceptions. We get that, especially in the world of biology and physiology. But, you know, again, do you believe in something? Because when you believe in it, this then fuels that mission once again. And so I'll explain there. Okay. Now, I will say that belief begins with personal experience. 1 + 1 is 2, 2 + 2 is 4. You can actually put pennies on a floor and do this. You can figure this out, right? You have personal experience that math supports these outcomes that you can expect as truth. Okay. Now, this personal belief is important because that then allows me to start to share that passion. But you'll notice it starts with personal belief and experience. And I'm sorry, personal experience leads to the belief. And we'll talk about that's where science comes into play. So prove it to yourself. Salespeople are going to come in, you know, they're going to give you a wonderful, wonderful pitch on why this thing is going to revolutionize your practice. Hear them out, listen to them, take notes even, but make sure that before you ever think about offering this to your patients, that you have vetted it out yourself. I mean, it kind of shocks me the number of purchases and additions to inventory that veterinarians make without ever actually holding it in their hand, with ever actually looking at it, or in best case scenario, experiencing it, trying it out, right? I mean, we just suddenly say, yeah, I'll take a dozen boxes of whatever the new drug is. It's like, wait, what? And that's great because personal experience says I can trust the foundations of science or this company's reputation and their historical precedents, and therefore I believe in it. And that's fine too. I mean, that's a heuristic that we can implement and it works, right? But it still concerns me that we make so many of these decisions, you know, again, without ever experiencing it ourselves. Don't believe the hype, interpret it yourself. And that's really what I'm trying to get at here, is that holding that research in your hand, cogitating on it, you know, evaluating it. Because again, you know, I have amazing sales reps, right, from some pharma and food companies that I trust implicitly. They have never steered me wrong, you know, and boy, when they say, hey, pay attention to this, Ernie, I pay attention. I got it. But then I still take that extra step, say, thank you. May I see the data? Let's evaluate it ourselves. That's really that personal beliefs that I'm driving at here. I hope that's making sense. So again, evaluate the science, examine the safety record. Does it align with my core values? There are many, many products, many, many supplements, many, many services that are available in the veterinary world that I don't believe in, don't endorse, it's not my thing, because it's just not, again, my passion, my core competencies, my mission and vision for what I'm trying to accomplish. And that's okay. But again, where I think a lot of veterinarians go wrong is they just try to do everything or every new thing. And then you wind up finding by, you know, having that expensive coat hanger in the corner of the treatment area. That's not the way I want you to do that. So let's say that this new product comes in, somehow you hear about something new, the salesperson, whatever, at a trade show, you know, at a convention, at a continuing education opportunity, whatever, then you evaluate. And if you'd like it, then start to share this with some of your trusted team members. And so this might be your associates, this might be some of your managers, this might be your head tech. I mean, I don't know who that is in your world, but I'm now going to share with them, because sometimes when you bounce this amazing new thing off of somebody else, they're like, that's really not so amazing. I mean, I don't get it. What's the big deal here with that? Okay. If your team likes it, if the support network likes it, then I'm going to say, yeah. Now, one of the things I just want to kind of pause here for a second. I mean, if you go to CC Animal Health, they have a whole section on research, and I'm going to share with you some of the studies that I particularly think are helpful, but I want you to make sure that when you're looking at something like a Calmer Canine or the Loop for pain management and post-op care, go do the research yourself. Don't believe the hype, believe in your assessment and interpretation of it. So we'll talk briefly here now about the science, right? Because now it's the believe in it part of this process. So when we look at targeted pulse electromagnetic therapy, and we'll go into more of it, it basically, when you look at the Calmer Canine part of it, okay, actually putting these electromagnetic energy around into the brain, neural tissue, really the biggest marker that we're measuring is nitric oxide. And one of the reasons is it's easy. It's a well-established marker. It's something we can test for, so it's not something that, is really complicated. We've got validated studies to show that, hey, when NO pops up, certain things are a consequence or downstream effects. And so we know that when we have increases in nitric oxide, for example, endorphins, and now, a lot of the research is around anandamide, which is some people are calling the Bliss, molecule. And well, that's slightly different, but in certain contexts, but you get context, you understand, that we're seeing, wow, the feel good hormones, neurochemicals, I should say, are really, associated with increases in NO for sure. We also know that increases in NO are associated with downstream reduced inflammation. And, what's really getting a lot of his, for the past 20 years or so, when you look at the neurologist community, they are saying, okay, we're looking for NO as a marker to show that we've got decreased brain damage and cell death. So there's some cool stuff. So again, there's lots of research. We're going to go over a little bit of it today, but go back to look at a CC animal loop, and you can now look at it under the framework of what are the impacts of nitric oxide. And I will share with you a couple of studies I think were really well designed and executed in just a little bit. Okay. So if we kind of get into the NO thing again, everybody talks about cytokines, me included. That's my whole obesity thing. Chronic inflammation, the cytokines, especially IL-6, really is a big thing for sure. Now, I do want to point out one thing here. If you started listening to some of my wellness talks right around like 2003, 2004, I was always talking about BDNF because BDNF had just been sort of really been validated is the wrong term, but the consensus certainly in human physiology was that BDNF was responsible for brain plasticity, and brain plasticity in the context of neuronal axonal regrowth or growth. And so remember, we grew up, many of you, if you're as old as me in your mid-50s, we were taught that you had a finite number of brain cells. You better preserve them, take care of them, because every time one died, you were done with that brain cell. And that's nonsense. That's not true. And so as scientists realized, this wasn't true, they said, why is it not true? And BDNF was one of the things. And you might have heard me talk about it in the context of aerobic activity, because we know that sustained aerobic activity, particularly 20 minutes or longer, just stimulates the heck out of BDNF. It also resets, norepinephrine, dopamine, serotonin, and so forth. But, BDNF is part of how you can stay bright, alert, responsive, maybe prevent dementia and cognitive decline as you age. So remember that we're also looking at this in terms of, it stimulates BDNF, pro-anti-inflammatory, helps with axonal regrowth or growth. So it's very, very important. And again, we get back into that stuff. The net effect is reduction of neuroinflammation, as we now are calling it, and rebalancing the primary neurotransmitters. And this rebalancing is really important in anxious dogs that are having behavioral problems, because this is where, we start to have imbalances. This is why SSRIs are so important, because, hey, we can only attack one of those neurotransmitters at a time pharmacologically. And so, and again, this is where aerobic activity is the only thing we know. Sustained aerobic activity is the only thing we have identified that can reset all three major neurotransmitters simultaneously, which is why if you've got a behavior case out there, you've got to get that dog walking regularly, daily. Okay. It's just part of the treatment. Remember that even still in the UK, you can't be prescribed anxiolytics until you have undergone an exercise, so to speak, program, like a physical activity intervention first and foremost. But again, we know that when we look at targeted electromagnetic therapy, we know that it can increase in nitric oxide. And we know that one of the things it can do is rebalance this primary neurotransmitters. So that's it. All right. So one of the studies I want to share with you real quick This is Dr. Alvarez's study for sure. You guys are probably familiar with this study. This was done up at AMC, but the really cool thing about this particular study, which was done, to look at some pain, chronic pain, was that this was also done in conjunction with the Weil Institute. So Cornell Medical School, the Human Medical School. So McHugh was a co-author on this. Now, obviously, McHugh's done tons of research in this area, but it was really nice because you had Lilane and John McHugh working on this paper, and I mean this is a very, very well designed paper. This is one of those that I encourage you to go back and look at. I mean, a double-blinded, randomized, placebo-controlled. It's like I don't know what else you can ask for. I mean, it's hard to cross over surgical patients with back injuries, but that's really the only other thing they could have done. But what they found when they used the Assisi loop, in post-op recovery and pain, they found it had significant improvement. So again, post-op wound healing was accelerated when they used this loop. So again, focus right now on the treatment modality, the electromagnetic therapy, this pulsed field of energy. So this is what McHugh and Alvarez and others really believe in. They also evaluated opioid administration. So these dogs had a 50% less need for opioids. So this is really important because it accelerated wound healing and decreased pain, or at least the need for opioids by the prescribing. So again, double-blind, randomized, placebo-controlled. You do it. The final thing here, I guess I probably should have highlighted this too. No side effects. I mean, in medicine, rarely do we get to say that. It's like there's always like this one little, but may cause constipation or may cause brain explosion, right? We know there's always that little asterisk that you have to read, at the very bottom of the insert. But this is one of those things where it's like there's no side effects. I mean, there's no side effects. So it's really fascinating. Another study too. Obviously, I'm a little biased because this was done in where I live at North Carolina State University. And so, this is Dr. Zidan's study here too. Joe Fenn was also on this paper as well. So when we start to look at this one for neurotrauma, same kind of thing, we're looking at IBD, intervertebral disc extrusions for sure. This was a randomized placebo control, but this was a prospective clinical trial. And so what they looked at was post-op pain, so incisional pain. Obviously, they had a difference between the placebo and the Assisi treated group, but they also looked at GFP. And I don't know if you're familiar with GFP, but in the human literature, they often describe this. This is sort of like nitric oxide as far as how the brain is healing, how neural tissues are healing. So you'll see GFP pop up a lot. But basically, when we see these levels drop, we know that it's probably protective. So you'll see GFP now. There's a lot of interesting research being done on can we reattach nerves, severed nerves, and so this is sort of the Chris Reeves stuff. And so if you kind of look at that, it's fascinating for sure. And I really appreciate Dr. Zidan and her team actually starting to apply some of those human metrics and markers to these vet studies. So this is actually a really interesting study as well. And greater degree of proprioception recovery. So that's also a nice marker that we can do. That just indicates, hey, the nerves recovered faster, they healed better. So I really like that study for sure. One other study, because again, we're saying you got to convince yourself. Remember, this is the second step. You have to believe in it, right? Do you need it? Do you believe in it? And so I'm just trying to lay out some science here for electromagnetic therapy for sure. And so when we look at it, this is the pilot study. Now, again, I apologize. Maybe I do tend to lean towards studies that are done by people I know or work close to. So this one, again, came from North Carolina State University College of Vet Medicine. And this was the pilot publication in 2019. I will say this was, I think, was 10 or 12 dogs at this time when this paper was presented. They're now up to, and the Assisi people can quote me, but I believe there are over 50 dogs now that they've enrolled and been evaluating in this study. But this is the canine separation anxiety study that you hear a lot about. So again, the other two were more the post-op pain, recovery, wound healing and so forth. So this is the one that's looking at the canine separation, because remember, these electromagnetic energy, it's being used to modulate behavior, right? And we'll talk a little bit about the mechanism there. And also it's going to be modulating healing and pain. So, and honestly, the way they work is very, very similar. It's just the targeted part of it. But within a month, 100% of cases showed improvement in the severity score. In this particular study, they were evaluating them on video as well. So not only did the owner report, hey, these are what I feel or saw or observed, but, they were looking back at video evidence to say, does that corroborate with what the person was saying for sure. Even if you say half the dogs in the study were just placebo, a 50% placebo effect, which is pretty significant, the data still held up. 56% of cases had at least 1 point reduction in severity after only 1 week. There is a couple other things too after 6 weeks, because remember, most of the time you need to, if you have a behavior case, a canine separation anxiety case that you're going to use the calmer canine, we recommend and certainly clinical experience bears this out, 4 to 6 weeks. Like that's kind of the barometer to see, is this going to help or not? So 6 weeks is better, but even around 4 to 5 weeks, especially if somebody's struggling, you can start to get some indication, some trend line if this is going to be beneficial or not for that patient. So this study, of course, looked at it at 6 weeks, which is the CC's recommendations. Half the owners said, hey, it was resolved. This stuff is just mind-blowing in a lot of ways. So within 6 weeks, 50% of the owners reported their dogs had resolved, no matter severe or less severe, didn't matter. The starting point, now it's resolved. Video said, hey, 80% had at least one sign improve more than 50%. So again, now an objective observer is looking at this. Again, there's patient, pet parent perspective, and then of course, objective observer in the study said, hey, half the dogs saw at least one disappear after 1 month. No side effects. Again, you and I know when we put these dogs on anxiolytics, we have to caution them about certain side effects, including constipation or something. But here's the cool thing too, and really definitely check back on their website or reach out to the Assisi people and see if they can give you some of the follow-up data that I've seen shared before. The signs of CSA continue to improve or remained at their reduced level in 2/3 of the dogs, even after it had been discontinued for 2 weeks. So this shows some, prolonged impact of this. Now, obviously, these are probably also byproducts of behavior modification that's occurring during the treatment process. So, there's a lot of variables that we could argue about, but the fact is that when you stop doing the loop, these dogs still showed, at least within 2 weeks, which is what they limited to here. And you can go back and look at some more follow-up data, but they're saying, hey, look, there may be a little bit of a halo effect. In my experience, we do tend to continue treatment for prolonged. I don't typically just stop it and see. We may alter our treatment regimens, but again, this was just assessing, hey, if we stop it, what happens? And so you can certainly try that for yourself. So now you've evaluated the science for whatever decision. Again, in the context of today's presentation, we want to talk about calmer canine and the CC loop. But if you can understand this, if you can believe in it, then that's when your clients accept your recommendations. People used to say, Ernie, how do you get these pet owners on these weight loss, obesity treatments? How do you do that? And I just think it was because me and my team were being authentic, genuine. We believed in it, right? We weren't just trying to sell you something. We had personal experience. We'd evaluated the science, and we felt very comfortable. It aligned with our mission for what we were trying to accomplish in our veterinary world. And of course, then we sort of stacked the deck in our favor because we knew that our clients were the type of clients who, for example, would pay for a therapeutic weight loss diet, who would come back for follow-up care, right? So, there's all of those elements are when people ask you the question, how do you get them to do it? Well, right? There's a methodology, a strategy. And again, you're trying to set yourself up for success, which we'll talk about more in just a little bit. This is just about earning it. This is just about earning it. I think that if you're sitting there today and go, this stuff sounds like a bunch of malarkey, please do not talk to your clients about this. You're going to be very frustrated. That is not the mindset to be in to try to talk to somebody about this. I'll never forget, I was on a consultation many years ago, and you guys know my passion. It's obesity, it's longevity. And so this vet was talking about how he was frustrated, his weight loss program, blah, blah, wasn't working or whatever. So I was kind of just trailing him and walking into the appointments. And, I I watched this one consultation exam that he did. At the end of it, this was like a 95-pound Labrador Retriever. It had obesity. And he was basically like, well, old Chloe here, she's a little chubby. I'll give you that for sure. And there's a lot of things you can do, but at the end of the day, it's hard to do. And you're just sitting there going, okay, what are we doing here, right? Like, you're not convincing me. If I'm the client, I'm going, whatever you're about to say next, I've already chunked it because you basically told me you didn't believe in it. So, you earned this. You earned this. Getting back to that, your clients want it. You got to ask them, and so if you're really interested in this modality, if you say, hey, you know what, I wonder if my clients would go for something like the Calmer Canine, I would ask, and I would do it in two ways primarily. Number one, when you've got those really good, loyal, trusted clients that come into your clinic, regardless of if they have a dog or a cat, regardless of if they've got a CSA case or have ever had a CSA case, just walk them through it. Say, hey, look, I really appreciate you. You've been just a wonderful client for several years. I'm thinking about bringing in this treatment for dogs with like separation anxiety. Like when the pet parent leaves the house and they like chew up the furniture and bark, 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 bark. Okay, yeah, you know what I'm talking about. Okay, so basically it's a loop that provides an electromagnetic energy pulse that helps modulate therapy. And as outrageous and outlandish as that sounds, there's some science to support that it can really help a lot of these dogs. The cost a couple $100 or so. Typically the owner does it a couple times a day, 15 minutes a day. It's got a little cute vest they wear. It looks like a little halo, like an angel's halo on the back of their head. I mean, do you think dog owners in our areas would be interested in that? Like that conversation. And it only took me 30 seconds to actually lay out the pitch to you just then. That conversation can tell you so much because you can see them light up their face, and go, oh, wow, oh my gosh, my neighbor, her dog is doing that all the time. She would love, right? Suddenly now you go, data point one, right? Or if the line says, I don't know. I mean, $200 sounds like a lot. See, you now have your community identity, right? This public identity. It's sometimes that simple to understand because that trusted client, unless they're an aberration, an extreme example of whatever your spectrum of clientele is, they're probably going to give you some insight into what the average client, the normal everyday client might be interested in. All right. So this concept of healing at home is really powerful, and it's something that is happening with or without our endorsement, okay? People are starting to say, how can I take control of my pet's health? That is what millennials and Gen Z pet parents are demanding, right? This isn't even up for debate anymore. It's like, we want more control over our pets' data, we want stuff delivered to us. We want people to come to us. We want control. We want to be able to ask the questions, right? And nothing is wrong with that. I agree with every one of those sentiments, and I believe that they deserve to be treated that way. So this healing at home concept, say, what can you do to help promote DIY care? Because this part of this control, the reason that Dr. Google exists and beats us in almost all the metrics when it comes to who do you trust and where do you go to for questions about your pet's health, because they want more involvement and control. So lean into it. Start to provide unique services. See, you get where I'm driving at already. I like things like the Calmer Canine because it allows me to extend and amplify. I want that to rattle around your brain. Every time you have that behavior case, is there some way you can extend your services beyond the four walls of your clinic? Is there some way to amplify your services beyond that one client? I mean, this is where this DIY in your home, at home, really starts to become powerful and scales. You can also be leveraging technology, and we'll talk a little bit more about this as we kind of move forward as we get toward the end of this, but video conferencing and telehealth. Again, this is the kind of stuff where people would do more follow-up care if it were more convenient. The logistics of putting your dog or your cat in the car or in transportation to the clinic, then waiting in a lobby that's noisy and smelly. And I mean, come on, no matter what we try to do to make it friendlier and lower stress, it's still a stressful endeavor, right? We're just trying to knock down the temperature a little bit. But let me tell you what, you can't go from here to there. It's just impossible, right? It's no different than you going to the dentist. There are certain obstacles you just can't overcome. Now, in fact, I'll tell you a great idea. I wish the dentist would come to me. I wish they could just pull up in a van. Let me go out there, clean my teeth and go. Maybe that exists somewhere. I don't know. If it doesn't, hey, let me know. What do they say on the YouTube? Let me know in the comments below for sure. All right. So what can you do remotely? I mean, this is where diagnosing, separation anxiety and chronic pain remotely, this is why telehealth and telemedicine, remember, if this is your client, you can diagnose them right over the video conference. There's no barrier there. It's just establishing the VCPR. I mean, you can do a teleconference with your client. You always could. I mean, this is, if you read my dissents from the AVMA telemedicine, guidelines from several years ago. I mean, you've always been able to do this. We've always done this. People have called me on the phone for years and I've done these consults, right? Prescribed, diagnosed over the phone. So video is way better. So this is your client. You can actually set up these medical video appointments if you want and do it. And I know a CC, you can go back and look in their archives. I've talked about this, I'm everywhere for the past several years. I've talked about this for sure. Again, we're not talking about establishing a veterinary client-patient relationship. We're talking about, no, this is somebody I saw, 3 months ago. You can do this. And so I think that this is where these opportunities really come into play. Videotaping for separation anxiety, that is the best way to really identify what's going on, to get the diagnosis, to identify the triggers, to be able to really make, I think, meaningful interventions. It's kind of frustrating, even if you go back to the day, back when I was talking about videotaping your cat's eating, right? I knew that if I could actually see the behavior in situ, in reality, then I can make a better, more meaningful suggestion, advice, treatment recommendation for sure. You can, again, let's say the dog comes in and you're treating it for hip dysplasia, DJD in the knee or elbow, whatever, right? You can do your follow-up virtual evaluations here. Again, you're trying to reduce the logistical obstacles. Now, you charge for these appointments. In fact, if you go back, even if you go to Dr. Ernie Ward, I've been writing about this stuff, especially in the pandemic. When this thing first started up last February, I was like, dude, get on this right now because, we all saw the curbside and the shutdowns. So it's like, get on this now. So there's tons of resources. I've written articles, made videos, all kind of jazz. If you go check out drernieward.com. Okay. You can also package it with the bundle care. So let's say now that you do orthopedic surgery, this dog had a TPLO or you did a cruciate or whatever, right? You did I don't care what you did. You now say, hey, as part of our care, here's this a CC loop. Here are we're going to do 2 video follow-ups and whatever. You guys can get very creative with this, and a lot of vets are. But remember, we talked about this, do you believe in it? Do your clients want it? Do you need it, right? Mission, vision, all of these things are lining up. Everybody wants this in this way at this time. What else do people want? These terms that are highlighted on this slide right now are what's resonating with pet parents around the country. They want natural. They want drug-free. They want safe. They want gentle. They want things that use technology because they see how technology enhances our own lives, right? So those are the buzzwords. And quite frankly, if I'm describing stuff like this, like the Calmer Canine, they're natural, they're drug-free, they're safe, they're gentle, they use advanced technologies. So this is, again, syncing up with public sentiment. Pet parents are saying, this is what I'm looking for, right? And, it's funny, today during this obesity, we were also talking about management of chronic pain in pets with obesity. And, I was sharing a story about so many of the pet patients that we see, they're now 10 or 12 years of age. They have advanced degenerative joint disease, arthritis, coupled with obesity, and they're on 3 or 4 drugs just to manage the pain. And pet owners hate that. They don't want all these drugs. They fear all the side effects and interactions. They see the news, they read the articles. And, so what I'm getting at is this is one of those things. I've said it now 2 or 3 times, and every one of those papers, they actually say no side effects were observed. It's kind of like, oh, wow, this is something that I've got to sort of park here and put out there for the people. The cellular effects, again, if you look at those research papers that we talked about, especially, when we look at the pilot study done at North Carolina State University, these were the things they reported. Owners said less panting and pacing, less barking, howling, whining, less destruction of the home. Right. So those are the message points that are going to resonate. All right. So now the final step is, how do we set ourselves up? So we determined if we needed it, right? We determined, did we believe in it? We then sort of looked at, all the science and decision-making. Do our clients want it? And so far for me, the Calmer Canine and a CC loop is check, check, check. All right. But how do we then finally, we've made the decision. We want to do this. We feel like it's the right thing and the right time for this product or service. How do we set ourselves up for success? And this is where the hard work begins. And this is where I find most veterinary professionals fall apart. They don't do this very, very simple thing. That is, construct a simple plan. And you have to write it down, because if you think that your plan is just something you cooked up in your brain, that's about the value of it. As ridiculous as what I just said, that's the value of it, because you can't. And you guys have heard me say this for years and years and years. I say the value of me making goals and having all these personal and professional goals and all this stuff is the fact that when I write them down and actually look at them back in paper, it's physical manifestation. I suddenly go, I don't know if that goal really is what I'm trying to do. Does this really benefit me or my family or my practice, right? I mean, so writing it down is just an act of transference into the physical realm that then makes you face back and then reevaluate it. So this loop is really important in you evaluating if it's going to work or not, for sure. So write it down, please. How are you going to train your staff on this new thing, right? So CC Animal Health, they have great resources. So I'm going to sit down, I'm going to say, okay, I'm going to talk to them about this. How am I going to educate my clients? Again, we'll share with you some launch ideas for new products or whatever. What are the prices? How much are you going to charge for it? I mean, this is something really important. Before you decide to do this, make sure you evaluate, what are my pricing scenarios? And we could go, and I've written, and many, many others have as well. I mean, there are different ways to model and forecast this out, but you need to look at, what does 10% price up or down actually impact on your projections and profitability? And how many would you have to do to break even, for example, if it's an infrastructure investment? I mean, there are lots of ways to forecast so that you don't make bad decisions just because, hey, it's a really cool thing. Best conditions to treat. I find that this is one of the most helpful aspects of this exercise. If you can, let's say you want a new thing, right? Whatever it might be. If you can only come up with a couple of best use cases, best conditions to treat, I'm going to start to already say, it really depends on what those use cases are, right? So I want to see that list of when would you use it? How would you use it? Because we really need 3, 4, 5 to kind of even make this thing get off the ground, in my opinion. Now, there are exceptions, obviously. I mean, there's like a great cancer treatment right now for a specific type of cancer. It's a home run. That's a no-brainer, but you understand what I'm talking about. And then what are my goals? I think also vets fail to actually project and get expectations. And then suddenly they look at this thing a year later like, oh gosh, we aren't making any money. We're not even doing it because they never had a goal for it. So blah, blah, blah. You get this. What would I do at launch? So again, we're going to kind of frame this within the context of the CC loop and the Calmer Canine. But again, you can apply this to anything. Number one, whatever new thing you add, you need to have a strategy, a plan to say, how can I encourage my clients to share this on their social media? This is the best type of earned media that you can get. I will tell you this. If you ask them, I mean, this goes back to the old, class 4 laser days. If you look at my lectures from 10, 15 years ago, I was saying the best thing you can do is ask your client, say, hey, you want to take a picture? You want to take a picture of you and Buster while he gets the laser therapy? And that thing wound up straight on Facebook, right? I mean, that was just like boom, 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 boom. Everybody wanted to come in and get the crazy glasses and they were curious what was going on, and their dog had hip dysplasia. And we got referrals, self-referrals, all that kind of jazz, right? You just can't buy that kind of advertising. I want to point out right here, this is a CC Animal Health's Instagram page. follow it, check it out. They are constantly sharing, customer or pet parent testimonials. So this is also a great way to get ideas and content and stories to share and so forth. So definitely check out, it's a CC Animal Health on Instagram. I mean, they do a pretty good job. I mean, and thank you, CC, for your Instagram presence, because it helps, when I'm telling people about it, honestly, I say, hey, check it out. Go check them out on Instagram. So a pet parent say, what is this stuff? Say, hey, you on Instagram? Yeah, go check it out. So I'd like that for sure. From some of the content ideas, these are some of the headlines. Now, all of this stuff, again, is on the Assisi Animal Health Calmer Canine website. They got tons of resources. And that's why I just sometimes don't reinvent the wheel if you don't have to. But they had a whole article on certain breeds may be predisposed to separation anxiety. Now, that's kind of my terminology on what they're saying, but they actually did a survey last year, and they came up with the top 10 breeds. And, look, we can argue and debate all day long, because again, separation anxiety transcends breed, right? This is individual, this is environmental. There's a lot of factors in there. However, these are the kind of things that you can make blog posts about, you can share. And so while you're getting the bigger message out that any dog, any size, any age can develop or suffer from canine separation anxiety, you also want to highlight, hey, there has been some interesting studies done, surveys showed these top 10 breeds, yada, yada, yada. Also stuff like the age, So again, what I'm just saying is, if you're trying to think of content ideas for website blogs, which that is going to be the big thing. The other thing too is dogs that are with separation anxiety have other anxieties. People want these kind of stories. Again, this is from that CC Animal Health owner survey thing they did last year. But if you start there's tons of content that you can build right out of here, right? I mean, there's stories to be told. July is coming up. So fireworks, you can link fireworks to canine separation anxiety and say, hey, if your dog is afraid of thunderstorms, I mean, we're about to come up into spring thunderstorms here in the Southeast United States. So if your dog is afraid of thunderstorms, you might also want to be evaluating for canine separation anxiety. Okay. So, I mean, there's simple things you can do. Also, I will say this on the calmercanine.com website, they have got a little quiz to help pet parents identify if their dog has canine separation anxiety or is at risk. So again, you drive them there, they get a positive result, hope not, but you know what I'm saying, then they come back to you. So this is just a nice way to do it. So how do I explain a technology that sounds like it should be on Mars? It sounds like Tesla invented it. Yeah, and kind of Tesla might have had something to do with it, but I digress. Number one, you got to keep these messages simple. And I'm sure you can get copies of all this stuff from CC, but the way I tell people is, in simplest terms, the CC loop, the Calmer Canine, it's a coil of wire, okay, that turns an electrical impulse on and off. Now, this wire is created so that it creates a three-dimensional beam of electromagnetic radiation. Okay, so it's making a shape that emanates out from that loop. Okay, so it's not just in the loop, which I think people think, oh, it's just in here. Well, radiation is three-dimensional. So that three-dimensional shape is actually where the targeted part comes. Now, this thing is pulsing on and off, and that's the secret sauce that a CC won't let me know. So it's pulsing off at different frequencies, durations, and strengths to target these neuroreceptors, these cellular receptors. And what they're really targeting, if you think about those positive and negative charges, now you start to realize, oh, I get how electricity could influence that, right? It can make a receptor more receptive or less receptive. So they're really, if you just think of it in terms of the calcium, ion, so you can start to realize, oh, so if it's pulsing on and off, we might drive calcium in or out of a cell, which we all, most of us understand that that's a cellular messenger, chemical that helps do a lot of cellular processes, not a catalyst, but, it sort of is that part of cascade. So we understand now, oh, it's turning on and off. It's targeting certain tissues with certain receptors, with certain negative or positive charges. This is how you can start to articulate the story. So again, that specific reaction, the calcium, These then go on to anti-inflammatory, swelling, edema, wound healing effects. I mean, you guys can spin this the way you want, but I think people need to understand is that this energy, and this is the same principle that like class 4 laser works on. And I would argue, while it's certainly not the electromagnetic energy, but if you do acupuncture, especially if you use electrical assist in your acupuncture, then you're basically playing into these similar mechanisms. So, and I know I'm starting to stretch a little bit to the edge there, but all of this sort of works in a very similar fashion. And, again, we are comprised of electrochemical reactions. Like right now, me being able to talk to you, you being able to hear, more importantly, you being able to comprehend, and me being able to try to make some sense of this is all a direct result of electro-neurochemical reactions that are firing in our brain at a blistering speed of about 400,000 bits per second. Yep, that's pretty fast. And in fact, if you're just curious, me speaking to you and the conscious bandwidth is about 120 bits per second. And for you to understand the words coming out of my mouth, not actually all the micro expressions, but that's about half that bandwidth, about 60 bits per second. It's estimated that's what your brain requires of the 120 that the conscious brain. So there's a lot going on that we can't do it. Again, this has been around since the early 1990s. It's really gained a lot of I guess, recent press when it comes to PTSD and chronic pain in humans. So again, and here's a little bit too from Dr. Gruen at NC State. There's a quote here that I just tried to share with you. There was one dog that barked 855 times in an hour, and after 1 month of treatment, he went to 0 barks. And those are the kind of stories that you want to share on your social media. I know I'm getting along. Contact your local media. They love this story. If you're in small town USA like me, these are the kind of things that get you press. And more importantly, again, this distinguishes and differentiates you from all the other vet clinics. Natural, safe, gentle, right? Non-drug, technology. It checks all the reporters' boxes. I mean, these are stories that get you not on the front page, but maybe on the front page of the lifestyle section or whatever it might be. All right. Again, working with animal shelters. I mean, you guys know this stuff. I want to get to some questions too. All of this should really be driving you to make a website blog. I will continue to overstress the importance of you owning where your content resides. People that post stuff on Instagram and on Facebook, remember, you don't own that. That can be turned off. It can be shuttled away. Your clients can no longer have access to it or be promoted. You have to put it resident on your website. You can then link back to from your Facebook to your website, but you want them to go to your website, A, because you own the intellectual property, you own the stuff. But number two, that's how you convert them. There's no point in them learning that you guys do the Calmer Canine in your clinic if they can't get it. So you want to make sure that that is seamless and easy. And so right there on your page where you've got this cool technology that you link back from Facebook or Instagram to your website, you now say, hey, you want to learn about this? Call us now. Click here. We'll email you or we'll text you, whatever it might be. That's how you convert